before the program, I was really lacking the confidence, and I almost didn't join because of that, because I thought, I don't know if I have what it takes. Maybe I don't. Maybe this program works for other people, but will it work for me? Can I make it work for me? I learned that I do have what it takes. My confidence has shot up there, and that surprised me.
Hey everybody, I'm Maggie, UMD, functional and holistic medicine physician and owner of Transform. And today we have a wonderful interview with Lori, who's been struggling with years of symptoms from a connective tissue disorder. We would call it MCTD if you wanted a synonym for it. And she was struggling with huge symptoms with pain, with mood, and extreme bone-crushing, life-crushing fatigue that impacted upon her family. I'd love for you guys to watch her journey and see where she is now just a few months later and how she overcame some of these obstacles. Enjoy the interview. Hey, Lori, I'd love for you to introduce yourself to our audience.
Hi, my name's Lori, and I'm a stay-at-home mom. I have one child who's 12, and I was diagnosed right after he was born, 2 years with undifferentiated connective tissue disease. So it happened, right after he was born, so I've been living with that, and I just feel like there's a reason why that happened. I didn't know why, and I felt like I've lost out on some of my life with him, and I wasn't always present, and so I wanted to find new ways to help that, and I've been searching, and then I found you.
Okay, so question, which is undifferentiated connective tissue. We're talking, it's in the family of MCTDs, mixed connective tissue disorders, but it's, my question for you is that he's 12, so you've had symptoms for 12 years, correct? Or do you think it even went way back when you look at some of the other symptoms that you had?
It was way back to when I was probably in high school. I noticed left knee pain, and I still, and when I was a barista, I couldn't handle all the manipulation of making the espressos and things like that, and the computer work. Like, there was just pain that wasn't explained.
I think it's fascinating to me that a lot of people don't realize that even though some people are still looking for diagnosis decades or years later, but even if you have a diagnosis, let's say they say, oh, your connective tissues and under the attack of your immune system. Once your body is mistaking one part of your body as a germ, the likelihood that many parts of your body is going to be mistaken as a germ is 100%. So we're not talking just connective tissue symptoms. Like, there's a myriad of symptoms. And when you look back, it predated your diagnosis by what, 20, 30 years at least?
Yeah.
Okay. So a lot of things that people miss and not realizing how many symptoms there are. So what were before you started the program, you graduated a couple months ago. So it's only been a couple months since you started this program. Yeah. So my question is, what were your symptoms before you joined the program just like 3 months ago?
Well, I have some top ones, there's many, but my top one was fatigue. It was hard to get through the day. It was hard to, if I would work out, if I had the energy to work out, I was only working out 2 to 3 days a week, whether it be a walk or at the gym. I would just get tired in the afternoon, and then having to help my son with his homework, I'm like, I couldn't think straight, or I was tired.
Yeah.
It was hard. So fatigue was one thing that I really needed to turn around, because I wasn't able to go places and travel and have the energy to do that kind of thing.
Right.
And those are fun things to do.
That's life.
Yeah, just having the energy to be present in life and be present with my family and do the fun things with my family, it wasn't happening. I just wanted to stay in the house.
Fatigue is huge. So what was number 2 or 3?
My mood. I didn't have a lot of get up and go, like in the mornings. Most people just, okay, I'm ready for the day. Yep. And it took me a while. I didn't want to get out of bed. I just wanted to kind of, hang out there. I didn't want to leave the house a lot. I just didn't have any motivation to do a lot of things. I didn't feel happy inside.
Joy. So you were missing your zest and your joy.
Mm-hmm.
Okay.
Yeah.
Been there and done that.
Yeah, so that was another thing, you know, and I do have pain, you know, I had pain coming into the program, which is improved. But that was another thing, you know, of course you want to improve your pain so you can do more things, you know.
What was your pain level?
I say it was around a 6. Now, when I first was diagnosed, it was a 10. I couldn't open a door. I couldn't empty the dishwasher. I had to have my husband empty the dishwasher.
Yeah.
So I made some changes, right? Some dietary, like removing gluten and things like that. But I seemed to cap off at like a 6 or 7, you know.
That was the best you could do, was to bring it from a 10 to a 6. And that
Yeah.
was lifestyle changes that you directed, but also medication as well, correct?
I did. I went on one medication, Plaquenil, and then the diet, I think the gluten helped tremendously.
And this is before the program. So you were, through efforts of your own, working with your conventional doctor with the medication and working with your own research, able to get to a 6. Okay.
I did. Yeah, I had some good things going, but it wasn't quite enough. I plateaued.
Okay. So people want to know, where are those 3 symptoms now? And that's just 3 out of like 10. So where are those 3 symptoms, top symptoms right now? Where's your fatigue?
The fatigue is amazingly better. And I mean, the best thing is to have the energy to help my son when he gets home and to pick him up, take him to school. You know, I would struggle with, oh, now I have to go pick him up, you know, and I was tired. And then we'd have to figure out homework and, you know, and now I'm like, dude, I'm learning like math and I'm enjoying learning the history. He's learning about India, you know, I'm enjoying the homework part of it and writing.
You're learning with him.
I'm learning with him now instead of just struggling to read a sentence and then read a sentence and then read a sentence again. So that's
why you had a child.
Right. And this was like, say, when the COVID happened, I struggled. This was before I joined. I struggled with at-home learning because it exhausted me. And I was a little anxious. Like, I'm not as anxious now. I guess that goes with the mood part, but I'm not as anxious. So I'm just able to focus more and have that energy and go on bike rides. Well, I rode his bike. I'm getting a bike, but I rode my son's little bike. Which I know.
Okay, that would have been a sight.
No, I know. Well, it was just like, oh, I want to see if I remember how to do this. I wouldn't have done that before. Like, I wouldn't have even gotten on the bike
I
before.
think Braden commented on that.
Braden commented, well, we go on bike rides and I don't have one yet, but I go on walks with them too. And the best comment, this is with like my energy, you know, how much it's improved. He said, Mom, since you've been in school, you're so fast now, we can't keep up with you. And we can't catch you. So, you know, he knows I'm in school. He knows I'm working hard at this. He sees, and he's noticed improvements. And that made my day.
Wow.
That was a big win for me. That was a big win.
You mentioned being able to ride the bike. Well, where's your pain level? Because you said you were able to get from a 10 to a 6 on your own. Where's your pain now, just a couple months later after joining the program?
Well, the best thing about the pain, because at night, you know, I would get stiffer and my knuckles, you know, would hurt. Now they didn't get stuck anymore, right? Because I'd had improvements. Like when I was first diagnosed, I would get stuck in the middle of the night. But now the knuckle pain is gone at night. Like I don't have any stiffness at night anymore. And, you know, I think my overall pain is like, I want to say a 3, but in my knuckles, it's like a 1. Like, I think it's decreased by half at least.
Okay. And to the point where, what's happening with your medication with your doctor right now?
Ooh, so after the program, I went into my doctor. This was 2 months after the program. I went in and I was like, you know, I'm feeling a lot better. And I haven't been taking my second dose of Plaquenil for a while. And he goes, well, you can just skip that one. You can just take the one a day. So I did decrease by 100 milligrams. And I'm still on just the 200 in the morning. So I'm on one pill a day. Yeah. So
I mean, and the question is, to me, it's like a lot of people will try to go down on medications themselves without actually implementing all these tools and results from the program. And I call that setting yourself up for failure and a major flare. That's why people struggle so hard trying to decrease the dosing or off medications. To me, the timing with which you did this is you had data, and then you had results that were a period of time. And then you had a discussion working with your regular doctor, and both of you came to collaborate together to decrease the dose. And even with lower dosing, you are setting yourself up for success because it's working even at lower dosing. You're not having to withdraw, or you're not having to go back up again.
No, I haven't. I have not. No, I'm still doing good.
I love that.
Good.
Well, this is what I call setting yourself up for success. Don't try going down on medication or off medication without implementing all these other tools and having a history of success. And to me, that's what communicating that with your doctor to say, hey, this is what I'm learning. This is what I'm doing. Will you work with me to actually continue to lower the dose of this medication? Is how I think that's a really important collaboration tool to teach people how to do.
Yes, I'm very lucky that he was open to hearing all about what I've learned in the program.
Yeah.
You know.
Question. What do you think caused these symptoms with, the fatigue, the mood, the pain to go down in such a short time frame? What was the secret sauce? What do you think really was pivotal in this change for you in such a short period of time, just over 2 months?
Well, I had a couple of things that really, really made a difference. And the first one was the hardest one. It was the blood sugar balance. And it took me a few weeks in the program.
So long.
Well, I was, you have to learn how to do it and make it work for you. And
most people coming in think they got blood sugar licked. They think they have blood sugar mastery. Were you one of those?
Yes.
Oh, so you came in thinking I'm the master already. And then?
I just learned better how to combine my foods and how often to eat. I didn't realize I wasn't quite nourishing my body quite often enough. And that right there just helped with the mood as well, and the fatigue.
I know those are mood and fatigue are one of the fastest symptoms to turn around in our program, as you're demonstrating. So blood sugar was one of the pivotal.
And then, the hormones was another big piece for me. Just, because once I got those results back and I started implementing some things with those, I had immediate turnaround.
Immediate with hormones?
Yeah.
Like what?
like a day or two. Like seriously, implementing those hormones, I noticed within a day, I'm like, oh, I have a little bit more energy to get through the day. Oh, I can get out of bed today. I was so excited, it's like, I want to get out of bed.
When you say implementing those hormones, what do you mean? Do you mean food, supplementation, medication? So our audience is clear. What did you do that caused within a day or two of difference?
Well, it was supplementation. It was supplementation.
Based on your results.
Based on my test results that I learned how to interpret through watching the modules and taking notes and then presenting them. And I understood the results. So once I did that, and I eat, I try to eat according to balance my hormones as well, like the cruciferous vegetables and that kind of thing. But I would say the supplementation and implementing that is what really kind of turned me around.
I call that a data-driven approach to personalizing supplementation.
Right, because you just don't want to go and buy something off the shelf without knowing.
That's what most
having someone, being in collaboration with somebody or knowing your test results and knowing how to read those.
So those are the two biggest secret sauce for you.
Yeah, I think so.
What has been the impact on your relationships as a result of some of the changes that you've seen in your health?
Well, the first one is I laugh more. Like that, I laugh more. Yeah, the joy has returned. So for instance, every year I get kind of down around Christmas time.
Yeah.
I just did. And this year was different. I was so excited to put up the tree. I was excited to go out and shop, even though I didn't shop as much because of COVID, but I was excited to go out shopping and I loved wrapping the presents. Like everything about the holiday, just I was happy. And my family noticed, Christmas morning, opening the gifts, I felt just content and grateful.
I love that. So grateful, gratitude and joy is back.
Yeah, it is.
Love that.
Every day.
I love that. Okay, what was your favorite part of working with us in the program?
I have to say two things. The education is why I joined. I really wanted I was so confused before I came into the program and overwhelmed with all of the things I found on the internet, and I didn't know how to decipher it, didn't know what it meant. And when I would go see my functional medicine practitioner, who I like, I was still leaving confused. I'm like, well, I don't see how that relates to that, and I didn't understand. So getting in there and learning about the 5 pillars and watching the modules, which there are quite a few, but just taking my time with it and taking my notes, that right there was my number one reason to join.
Comprehensive education.
Yes, because I'm going to have that forever.
Yeah.
You know, I need to control my autoimmune forever, and I need that education to help me do it.
Well, you're going to be the pilot and no longer the passenger in your health, but you need a pilot's license to do that.
Yeah, I learned so much. I'm still learning.
So you said that was the first favorite thing.
That's my first favorite thing, but another reason why I joined is because of the community. You know, I really felt like I was alone in this autoimmune journey because, you know, my husband doesn't have anything. My son, luckily so far, doesn't have anything except allergies, a little bit of allergies. So I got to watch that. But anyone that I've known, that I do know that has autoimmune, are treating it just conventionally. So no one is doing what I'm doing. And then once I found this community online, I'm like, oh, you know, there's other people that are going this route too. And I loved the fact after joining, you know, everyone in the program had a different, you know, immune symptom or cause, but yet we were all learning the same thing to fix it. Like we were all learning the same thing. We could all bounce ideas off each other. If you had a question, you could, you know, post it in the den and get an answer. So just having those people around to support you and me is what made me really, it's one of my favorite things about the program.
It's funny, no, I think the more symptoms that we come up with and the longer we're sick and the more research we do and the more we go into offices where people can't help us, the more we feel like a super special zebra and the more lonely and alone you feel. And eventually people feel like you're the only person on the planet that has this myriad of symptoms and obstacles, when in reality, there's probably 20, 30, 40,000 Loris just in your state alone.
Exactly.
You know?
So just having, you know, these people rally around you and, you know, support if I'm having, you know, a question or just supporting me and knowing we're all going through this and we're all learning and we're all making progress and we're all having wins. So that made the difference.
That's a big difference. Celebrating wins in a community, dealing with autoimmunity. When have you ever heard of that?
Never. And that is so empowering. You know, he's like, oh, look at her win or look at his win. Oh, well, you know, I'm going to have one of those too. And it really motivates you to just keep going, keep learning, keep trying.
You know, in our program, I call that focus is power. And what you focus on grows. And you were talking about how when in the morning you didn't even want to wake up. And I've been there probably a decade of my life where I wake up in the morning and I used to think FML. You know what that means? Like, and my first thought in the morning used to be, what else can go wrong? Like, what else is going to go wrong today? And when you focus on that, guess what you manifest all day long? More shit that goes wrong. And so for me, that was a big pattern interrupt in our program, the mindset work that we do. And the first and most pivotal one is actually we focus on wins and celebrations. That's huge.
No matter how small.
You think they're small, but they're not. They're huge. Like somebody would be like, oh, I was able to walk outside for 5 minutes. That's not small for somebody.
Right.
That could be huge for somebody.
It's huge. Yeah. And also like each win may lead up to an even bigger win.
I agree.
So celebrate all wins.
Because guess what? You'll manifest more.
More wins.
That's what we see all the time. Lori, you brought up something that I want to follow up on. You said that you had worked with functional medicine doctors before. So there's a lot of people out there watching who says, you know what? Why do I need her? Why do I need this program or this protocol? I could just go find, 1, 2, 3, 4, 5, 6, 7 functional medicine docs to work through the next 7, 8 years on to try to get all this stuff done. Well, what is the difference? Like if you already worked with some functional medicine doctors and then you did our program, what is the biggest difference that you see? Why do this instead of go work with the next 6, 7 functional medicine doctors over the next 6, 7 years? I
just made progress so much quicker going through this program, and I learned so much so that I was just able to implement more things and when I would leave, the functional medicine doctor's office, I'd usually be confused. I didn't understand what they were talking about, or I'd have questions. I couldn't get those answered. Like, they don't have time to explain things to me in that time that I see them.
Mm.
And to me, it made a difference having this education to really understand, okay, this is what I need to do, and this is the why I need to do it. The whys of some, vitamin deficiencies and hormones and why they matter. So to me, the program just provided so much information and support, and I don't get all of that with one person and sitting across from just one person for 30 minutes or 40.
I think that's a good point. But one of the things I talk about is that there is a whole integration of all these pieces that feed into autoimmunity. I call it the dead simple strategy, is like the 5 pillars strategy. And for me, there really are not any autoimmune experts out there. Most people, naturopaths, even functional medicine doctors, like to specialize in one little piece of something. And they're not really an autoimmune expert that's going to put hormones, blood sugar, food mapping, vitamin density, gut healing, mindset work, community. Who the hell puts all that together?
Right. You're not getting all the pieces with just one person. They might focus on gut work, or they might focus on hormones, and then that's all you get. And then you work on that. So you're missing the other pieces.
But that's why you get results so quickly over just 2 months versus another 10 years with another 10 doctors.
Right. It's all of the stuff that you learn, all the 5 pillars, and working on all of them, especially in 2 months, that made a difference. I wouldn't have had that progress.
The question is, do you want to get better over 2 months or do you want to get better over the next 20 years?
I want to see progress in 2 months, Yeah.
And you had symptoms for 20 plus years when you look back.
Yes, exactly. So, and I, like I said, I'd made progress, but this was over quite a few years and I hadn't addressed everything. Not all the facets that can, that can cause an autoimmune flare or calm it down. I hadn't worked on everything. So, and even the mindset, I hadn't worked on that ever with autoimmune.
People are like, what the hell's mindset? Why does it even matter?
So it does. It really helped my anxiety. I had a higher level of anxiety coming into the program. I would worry about every little thing. And that has improved through some of that mindset work that we did with Senta.
I love that. That's Senta's our mindset coach.
Mm-hmm.
Love that. All right. Question. Why did you almost not join the program?
I mean, the cost, I was like, got to think about that. And can we afford it? But then I thought about it and I'm like, I've had this autoimmune for quite a while and I'm going to have it, it's going to be inside me for quite a few, forever, right? I have to control it. And I just felt like I need to invest in myself because I'm important. Part of my mindset work was finding out for myself that I'm significant. Mm. And if I invest in myself now with all this education, I'm going to have it forever.
Yeah.
I'm going to have it forever. And I can use that going forward because my autoimmune isn't going to just go away. I mean, it's going to be controlled, but it has to be controlled. And I need to know how to do it. And I just felt like having this program and support and the education for sure will help me do that. It will help me for the rest of my life.
What I'm hearing you saying is that you had to come to a realization that I'm worth investing in myself so that I get better now, so that I can experience the rest of my life and my family can experience me for the rest of my life as well.
Right. I had to convince myself that I was important enough, that I mattered enough to invest in this. And I do. And I'm glad I did. Like, I'm so glad I did. It was worth it.
What made this a no-brainer when you decided to actually join? What made this a no-brainer?
What have I got to lose? Like, I've been trying to fix this for so long. This can only help me. Like, why not do it now? Why not? It just seemed like the thing I needed to do for myself and my family.
Who would you recommend this program to?
It can be anyone. I feel like anyone who is ready to make a change and learn something new and dive in and kick ass, take names, chew bubble gum. I love that. That's my favorite saying.
Don't quote me or anything.
So anyone who is ready for that, anyone who was like me and who is like me, who is like I was and frustrated with where they are,
Mhm.
and maybe they've done so many things and they plateaued and they don't know where to go anymore and they're confused and overwhelmed. And anyone who wants that education, we have there's doctors and dentists that join the program
Yeah.
and they're learning all about autoimmune for maybe themselves or maybe their patients.
Mhm.
So just anyone who's ready, you got to be ready.
Love that. What was something about me working with me that surprised you?
I just like how you just lay it out there. You're not shy about telling, okay, this is how it is. And, you can create your own story. You talk about, creating your own stories. But, and so you're serious, but at the same time, you make it so much fun. Like we're always laughing. We're always laughing, you know.
I laugh at myself a lot.
And that's so good. That's what, when we're on the masterminds, the calls, the group calls, there's always joy and laughter. Like you make it fun. Like you're having fun up there.
I am.
Yeah. And then, it helps us, and we all are having fun learning and deciphering,
Lori, I mean, this program came out of the worst mental health and physical health crisis of my life that was brewing over decades, right? And this is my life's work, right? And at first it was to save my own life. And later it became, once I learned and implemented all this, it became, my mission to actually share this and teach other people how to do this, right?
Mm-hmm.
But at the same time, for me, one of the biggest lessons in life I've learned is you got to have fun. And when you're having fun and passionate about something and it matches with your vocation, that's like magic. And I have found my magic.
Every week. Yes, because I can see the joy in teaching us. Like, I mean, we might ask the same question, then you get another question, and it's the same thing, but you always answer it truthfully and with grace and joy. You never get tired. You never seem tired of doing what you're doing.
No, that's passion matching with your vocation. Then it's not a job.
Yeah, it's like you're just having a good time but you're helping us at the same time.
I love that. Awesome. What is something you learned about yourself that surprised you?
Before the program, I was really lacking the confidence, and I almost didn't join because of that, because I thought, I don't know if I have what it takes. Maybe I don't. Maybe this program works for other people, but will it work for me? Can I make it work for me? So I learned that I do have what it takes. My confidence has shot up there, and that surprised me. I think the mindset work helped me with that. And I'm doing it. I did it. I was able to do it. So don't, and one thing, if the Facebook group, peeps that are out there are shy like I was or not confident, what I did is I joined the water challenge. You had a water challenge.
Oh,
And I may have done
in our Facebook group. Yeah.
So that, I really participated in that, and I was like, I can do this. Look, I'm doing it. I'm interacting with everyone and I'm having fun. I'm drinking my water. I'm doing it. I didn't miss one day of hitting my goal.
And just in that 10-day water challenge, you got results.
Yeah, and I got results, like just more energy, more fluid in the joints. And so that after doing that, I made the call. I think that was when I made the call. I'm like, I need to call them and just talk with them and see.
Because
that gave me the confidence. I encourage anyone to participate in any of those group, group things that you have, the events, and test it out. Test the waters.
The Facebook group, Transform Autoimmune Disease Naturally, is so full of educational material, bonus trainings, and then we run challenges in there where people can engage. What do you have to lose?
Right. Take advantage of all of that. I was in the group for a long time before I got
a lurker?
I was a lurker. I was. And then probably about a year before I made a call.
Yeah.
Once I got involved and worked on that water challenge, I made the call, but still it took me a couple of months to have that confidence to, to commit. But I did, and I'm glad I did.
Well, thank you for sharing your experience in the Facebook group. I didn't even realize it was because of the water challenge that you finally, after a year, stopped being a lurker and became an implementer.
That was it. That was the kicker, because I just felt like I was a part of a group.
Community.
It was the community. Again, one of my favorite things about working with you is the community, and that sense of community, having that support during the water challenge. And I was fully engaged, in supporting others. That right there was the clinch. That's why I was confident enough to join. That's why I made the call.
I think you just reminded me, I might need to start another water challenge in the group again.
It really made a difference for me, It really did, because you can just do one thing, and then and you tell us, well, that's only the tip of what we do in the program.
Well, was it the tip of the iceberg? That was a 10-day water challenge. Was it the tip of the iceberg for you?
Mm-hmm. That was the first thing. Yeah. That was the first thing, and then after joining, then I got to learn all about the blood sugar and all these other fun things, but that was the tip.
I think there's no reason for people not to dip their toes into something, to even just start experiencing some of the immediate results of so many of the different things, resources and challenges that we offer in the Facebook group.
It was key for me.
Dip your toes in.
Don't be shy. Don't be afraid. I was even afraid to make the call still, just a little bit. I was like, well, I don't know, but don't be afraid. It's just a call. Make it and talk to you, talk to Elsa, talk to,
different people. How was it like that first call, talking to someone on our team? What was it like for you?
It was just a conversation. It was perfect. It was just a conversation like we're having now. And it was just, what things do you want to solve? What do you want your outcomes to be? It was just, going back and forth and just finding out information. So easy.
Effortless.
It was. And I felt good after it. We talked with Elsa for a while and, I felt good after it. It's like, oh, okay, this helps.
I love it. Well, Lori, thank you so much for your time.
My pleasure.
Commitment to the process, and your family's been beautiful to watch. All their reactions, their comments, their support. It's just lovely to watch.
Yes, they are very supportive of what I do. Yeah, my son's excited that I'm in school, and he's in school. Like he's excited for me.
Congratulations.
Thank you so much, Maggie. Thank you.
Boy, thank you for joining me on that interview with Lori. And I think some of the biggest takeaways is that she had worked for years with functional medicine physicians and conventional medicine physicians, and she wasn't able to get further on her symptoms. And that one of the biggest pieces I heard from her was that the integration of all these pieces working together at once was really what is necessary and crucial to create results within just 2 months, something that she wasn't able to achieve over a course of 10 plus years of working with multiple providers. The other thing I think that's really awesome about her is just her level of joy, zest for life, and confidence that's come up so much. Like it's a metamorphosis to have seen her where she was just a couple months ago and where she is now. So thank you for celebrating her journey and her successes with me. If you want to learn more about us, feel free to join our Facebook group, Transform Autoimmune Disease Naturally. If you're watching from YouTube, make sure you click subscribe, ring the bell so you get notified. If you're on IG, make sure to follow us. And thanks a lot for joining us on this interview and celebrating our successes with our clients. Have a great day, everybody.